Sanibonani Mzansi. I am your host Candice Kumalo and I welcome you to another episode of the Health from Mzansi podcast. In this episode, we'll be speaking about the issue of maternal health challenges in underprivileged communities and how they can be improved. My guest for today is Bonisile Mahlangu, a professional nurse and midwife with extensive experience in working with expectant mothers.
Hi Candice, I am Bonisile Mahlangu. I am a professional nurse and midwife practicing in Gauteng, and I'm a training specialist, so I'm a training midwife specialist as well. I've been doing midwifery since my community service. At the end of my community service, then they moved me to a maternity unit, an antenatal unit rather. I've been there since and realized that actually I like it, because in school I definitely did not like it. And a great space for you to be an advocate for your patients. So I really like it. I'm a midwife by profession and by passion.
I guess let's go straight into today's topic regarding maternal health challenges in communities that face significant barriers in accessing basic resources. So, Bonisile, as a professional nurse and midwife for quite some time now, how would you say is the availability and quality of emergency obstetric care in underprivileged communities?
So in a lot of communities, what the government has tried to do is have midwife obstetric units in and around communities. And these are like clinics which are headed by highly trained and specialized midwives. This is so that patients in communities like that are underprivileged do get the best care, but also it bridges the gap with everyone going to the hospital for something that does not necessarily need a hospital, but it is a pregnant patient clinic. So that's what MOU, midwife obstetric units, is a specific clinic made for pregnant women, and it serves pregnant up to 6 weeks post-delivery. And that's when a patient stops being like a obstetric patient. They are there in the communities. They are not enough, but they are trying to get more and more out there. And I think I've noticed other provinces, because it was mainly a Gauteng thing. And I'm noticing other provinces are also getting onto that bandwagon, as it is very helpful, because the patient can be stabilized very well at a MOU. And then from there, they can then be sent to a hospital should there be a need, or they can be well managed at a clinic as well, at that sort of clinic as well. They try very hard to get paramedics that are on standby between, like maternity paramedics that are on standby between our hospital and that clinic. And that helps the situation. It helps the patients receive the best care that they do need. Of course, though, there are challenges, like I said, just need in more communities.
So what would you say are some of the barriers to accessing maternal health care services in these communities, and how would you say these barriers then impact maternal health outcomes?
The big challenge is the crime. Like, we cannot ignore the crime in our country. It's a very, very big challenge, because some clinics can only run during the day because it's too dangerous for them to run at night. So that is a challenge that is also there, because some communities are very dangerous. With trying to help out some of these communities is the level of crime that is there in those communities. And ambulances also have a challenge getting into those communities. So sometimes an ambulance needs to wait by a bridge that is close to a main road and wait for a pregnant woman to meet them there, so that they can transport them to a hospital or another facility. So that becomes a big, big, big challenge, because that wastes a lot of time, whereas a person can be made quite sooner and be saved, whether it's the mother or the child, can be saved quickly. Another problem is that some communities are very traditional. So even though you can introduce like a Western medicine clinic, like an MOU or a clinic for pregnant ladies, some people would still much rather go to a traditional midwife, especially in villages as well, have traditional midwives. We have a lot of experience in helping pregnant mothers, but they do know their limits, and they do refer their clients to the hospitals and to the clinic. but there's still some sort of like pushback. People are reluctant to a system they don't trust. So some areas are very, very traditional based, and accepting a Western type of medicine is a system that they don't trust. And that also then tends to become a problem, because other things, like I said, if you can find them and get to them quickly, or if they can get to the hospital or the clinic quickly, then a lot of things are preventable and treatable in these pregnant mothers, because sometimes you do something and it's a little too late, especially in cases of bleeding. If a patient is bleeding, that is something where you need to act very quickly, immediately. And with pregnant mothers, we know that they're at high risk of blood pressure problems and all of that. So if a patient's blood pressure is now too high and they're not being monitored and they start fitting and they're so far from a facility, we find that by the time they do reach a facility, then we've already reached an adverse outcome where there is irreversible brain damage, or we've lost the child or something like that. So those barriers and those challenges do make it difficult for us to reach pregnant mothers as best we can.
I know you just touched on it briefly, but despite significant progress, as you've mentioned, many maternal challenges are believed to still be preventable. What would you say are some of the biggest obstacles to reducing these deaths and issues from causes like negligence, infections, or a lack of staff?
I think a big one would be educating our patients or clients about early warning signs. That makes it easier, because then you see if, for example, you are on the infection part. If you are someone who's sitting at home and you are a post-Caesar patient, or you've had stitches post-delivery, you can note an infection very quickly. You'll see if something is wrong in your wound very quickly. So good education, a strong discharge education, or even when they are at the clinics, because a lot of our pregnant mothers get told things about even what happens after pregnancy as well. You give them like a broad education about antenatal, interpartum, and postpartum as well. So you give them a good education on all of that so they are aware. But if we strengthen patient education, that can prevent some things that a patient themselves can be responsible for and be like a part of their health, because they are the ones looking at their wounds every day and all of that. I've heard some doctors, when they discharge a patient, they like, look at your wound each and every day. Every time you change your dressing, every time you clean your wound, look at it each and every day, because then you know, like from the day you leave the hospital, you must know what it looks like today. And then when you go out there, when you go back home, you look at it every day. That way you know when there's a problem. You'll know when it changes, whether it's for the good or for the better. You'll know when you are healing, but also you'll know when now there's something wrong and you need to come back into the system to be helped. With regard to staff, continuous trainings, man. You know, if we constantly have drills and trainings and in-service training where people are trained on the spot at work, that can keep healthcare workers like sharp. You know, if I'm faced with this challenge, this is what I do. If I'm faced with this challenge, this is what I do. Because some things don't happen every day. Sometimes when something happens quite often, you know how to manage it better. But now when you are out of touch with it and it doesn't happen every day, and then you forget like what to do when you are faced with that emergency. So I think continuous trainings for staff. We've been told the shortage problem is not a problem that can be solved overnight, and it's not going to get better anytime soon. So we do what we can with what we have right now. And that is, we involve the patients in the treatment as well with continuous education, because the patient can come in and tell you exactly what they're feeling and all of that. And that makes it easier for you to detect early warning signs as well.
Thank you so much for mentioning all those important points. Bonisile, despite physical health, pregnancy and postpartum periods can be vulnerable times for mothers' mental health. So how can healthcare systems better address the mental health needs of mothers in these communities where they may not always be understood?
Mental health is such a big part of pregnancy because it's a very psychological thing. Pregnant mothers all the time, they worried all the time, and you can have the smoothest pregnancy and then something happens in interpartum that disturbs your whole full 9 to 10 months of pregnancy. So pregnancy is a very mentally challenging state of one's life. So one thing that can be done, and it is emphasized in the new maternity guidelines. So we have guidelines which we practice with. So in the new maternity guidelines, they are emphasizing like mental health and support for the pregnant woman and when she's in labor and when she's postpartum and all of that. So screenings are done at every antenatal visit, like mental health screenings are done. Are you okay? How are things at home? And. But I think another thing that can be done to improve, especially when it comes to our communities might not understand what the pregnant woman is going through. She might be told, you know what, you're not the first to do this. Many women have given birth in the family. You're not the first to do this. So you need to pull yourself together and be a mother. But encouraging a pregnant woman to have a birth companion. So she would then pick a person who will come with her antenatal visits, like occasionally. It doesn't have to be at all visits, but occasionally come with her for antenatal visits. That way they check in on both of them. If it's a person she lives with, even better, because then you give them the power and the encouragement to be able to look out for this person, to better support this person. You give them tools on how to better support a pregnant mother or a postpartum. If it's a person who she's been with throughout her journey, that person can be let in to her delivery room when she delivers as well. That calms her anxiety quite significantly. And then the person will go with her to the postnatal ward. And then that way she feels less alone. A lot of pregnant women say no one understands what we're going through. So if there is a person who might not be in the same situation, obviously, if it's the partner or the mother or a friend or a sister, that person who is just next to them throughout the whole journey, I think that will make the pregnant woman feel less alone. And that will help the community because it makes the family also sensitive to her mental health as well. It makes someone else accountable for her mental health who's not just herself as well.
Thank you so much for sharing those valuable points, Bonisile. So in closing, what interventions do you think could improve the overall experiences of mothers in these communities?
Definitely more facilities. If we have strong, well-equipped, well-staffed facility in communities, that can then, we can definitely win with our mortality rates. If the government could have more dedicated mother and child hospitals, those that just do the pregnant mother and the child, because those are vulnerable populations. A child and a pregnant mother is the most vulnerable person who can enter a healthcare system. So we can just have dedicated areas for just those people. That would make so much more sense. It would take the strain of other systems in the healthcare system if we just focused on them. Because remember, a country's healthcare system overall is judged by the maternity and mortality rate, the healthcare of the mother and the child. And we're not doing bad. You know, the country, our mortality rates are declining and they are going down gradually, but we can do better. We can do more. So if we just have more trained staff, more skilled staff, if we just keep learning as a healthcare worker, taking it upon yourself to just keep up to date with what is going on, what's happening, with any changes in management, learning all of that. But being in a facility that is dedicated to those areas, then I think that would help our system quite a bit.
Thank you for joining this week's episode of the Health from Mzansi podcast. To find out more about being the healthiest version of yourself, visit healthfromzansi.co.za, or you can send us an email to hello@healthfromzansi.co.za. This is the Health from Mzansi podcast, and your ears are always invited. As we conclude, it's clear that addressing maternal health challenges requires a multifaceted approach. We may need to invest in robust healthcare infrastructure, empower communities, and challenge societal norms. Most importantly, we must continue to amplify the voices of women who face these challenges, ensuring their experiences shape the solutions we implement to create a healthier future for mothers and babies. Stay healthy and fancy. I am your host, Candice Kumalo. Until next time.